Hi everyone, talking a little bit more about our non-surgical or conservative treatments for bunions or hallux valgus, also known as hallux abductovalgus. What we're looking at here is really a deformity that widens your foot, and so having really nice wide footwear and lacing techniques that really help to unload that forefoot is going to be a good thing. So think of your high and deep toe box, your really wide toe box, and that's going to take a little bit of the pressure off. You may also consider some customized orthoses or inner soles into your shoes, and this is going to increase your biomechanical loading and really get that range of motion a little bit better through your your first metatarsophalangeal joint, your big toe joint. There's other different splints and props and dividers depending on how your pain's presenting. I typically don't really like all of the splints that are commercially out there, but they may help with symptomatic relief, and I know I use these a lot for, say, my hikers, just to add a little bit of extra padding, or to try and bring that valgus of the big toe back out, and then that's going to hopefully help them symptomatically during that. It's not necessarily going to fix any of the deformity that they've got though. Now with this, we want to slow the progression of your deformity, and for me that's about strengthening up the appropriate muscles, and there's some really good intrinsic strengthening, such as picking up sort of a tissue or your sock off the ground, as well as some of that resistance training with our exercise band, our TheraBand, to really start bringing that big toe back out. And that's all going to help make sure that we decrease the progression of the deformity, and that we potentially put you in a really strong position to recover from surgery as well. Now, photobiomodulation therapy or laser therapy is all about reducing the pain, reducing the inflammation and swelling associated with any type of pathology or condition. Now with this condition, we're able to reduce some of that joint swelling and the pain that may be associated there, and is so a really good option. Similarly, in corticosteroid injections, we can reduce that inflammation locally to the joint. It's not something I like to do in the lead up, say that first, within that 3 to 6 months before a procedure. But for those that are not in a position to undertake a procedure and have the right indications for a steroid injection, it's something that we can do quite effectively. Now, prolotherapy or glucose injections. What we're wanting to do there is really, one, desensitize the nerves surrounding the joint, and two, potentially cause a local acute inflammatory event if there's a few little things there that are causing concerns. We want to potentially break down or increase that uptake of inflammation as well. Now, when other things fail, we can look at our pharmacological, whether they're non-steroidal anti-inflammatories, and then other things like paracetamol as well, just to help us get through the day if we're not in a position to undertake any of our treatments. There's possibly lots more, but these are the main ones that I go to and talk to my patients about. Hopefully this has helped you out to guide a little bit of patient management, and let us know if there are any concerns there. But for the meantime, if you've liked this video, hit the subscribe button, have a bit of a look at some of our other videos, and we'll see you there. Cheers.